out of Africa. You didn't need a new microbe out of Africa to get AIDS. And
is that what they finally decided initially what it was? When they shifted from the gay-related immune deficiency, what did they shift to? What became their next?
Well, you had bacteriologists who thought, well, it must be caused by a bacterium. And of course, the virologists, they said, well, maybe it's a virus. So everybody was looking for a new cause for AIDS. And it's relatively easy to rule out bacteria and fungus diseases. But viruses can be tricky to find sometimes. So they used this new type of reasoning. They skipped the ways of proving a virus existed because they couldn't find any. So they found one in their mind. They found these RNA and DNA sequences, bits and pieces, and they put them together, and they said, well, if you put all this together, it resembles this virus or that virus. So it must be a virus.
Because they wanted to find an explanation.
Yeah.
Bacteria, whatever, they said, well, we're going to stick with the virus theory.
Yeah.
And since we pretty much, we're going to stick with it, we're going to hope to find it. And they didn't really find it in actuality, but they kind of found it in their imagination.
Yeah, it's a virtual virus. One of the questions that was raised, I raised that too. I thought, well, homosexual male activities have been around for a long time. So if it was caused by what gay men do, why didn't they get it then? Well, there was something new added, or some new things added to what gay men used to do in the past.
They were taking all the drugs and the antibodies.
The antibiotics. And then they finally, the police finally stopped cracking down on gay bars. So these guys just went wild. And a lot of people from Indiana went to San Francisco because they could have unlimited sex.
Right, it was just a free-for-all,
Yeah.
an orgy.
Yeah, and so you really don't need a microbe to explain why these guys were getting sick and dying.
That lifestyle would so weaken their immune system that it just couldn't recover.
Right. Well, in many cases it could if they stopped doing what they were doing and if they ate well-balanced diets and exercised. And then they introduced AZT.
They came up with some drugs to help them.
I think that was in '86. Yeah, they thought, okay, we'll give them chemotherapy. We'll give them this drug AZT, which destroys white blood cells, and we'll do it over a long period of time. It's not like regular chemotherapy where you give a patient 6 treatments for, say, leukemia. You can't keep those up because they'll kill the patient. And they didn't know what the correct dosage would be for AZT. It was just a wild guess. So they started off giving them 1,500 milligrams a day. And that's what killed a lot of them. And then they kept cutting the dosage down. I don't know what they're down to now, 600. And
what does the AZT do? Doesn't it destroys the DNA ability to multiply or something? Or what does it actually do, the AZT, that's harmful to you?
Well, it prevents DNA from replicating.
So that's what they're hoping to do, because they think that the DNA is replicating in a way that's hurting them.
Well, they realize that if you target DNA replication, you're going to target all the cells in the body. You're going to kill a lot of mostly good cells, along with...
You'll also kill the bad ones.
The bad ones, yeah. That's the whole basis for chemotherapy for cancer.
Is it like the old-fashioned thing about letting out your blood or something? I mean,
well,
that was probably more effective.
It probably would be more effective than AZT for AIDS.
So AZT, if I took it, If I just start taking, even in some of those smaller doses, what would I feel like?
Different people have different reactions to it. They did some big studies in Europe and in this country, and one of the studies, I think half the people on AZT had to have blood transfusion, or they would have died.
It was that destructive.
Yeah. Sigma Chemical Company in St. Louis used to produce AZT for researchers. I think they still do. And there's on the vial or jar of AZT, there's a skull and crossbones that says, do not let this material get on your skin. Wear protective.
AZT?
Yeah.
Wow.
Yeah, and it's a target organ, bone marrow. That's where all your blood cells.
It'll destroy your bone marrow.
Yeah, and they knew that when they said, what have we got to lose?
Right.
These people
they're going to die within a year anyway.
Yeah, they're going to die within a year, so there's nothing to lose, and we may lose a few patients not knowing what the correct dose is. Well, they did. They lost a lot of patients.
What happened to that fellow named White? That was the first case, the boy?
Oh, Ryan White.
That was the most publicized case. Was that Indiana?
Yeah, Lafayette.
So did you know about that case?
Yeah. I found out that his death certificate, they said he died from internal bleeding, which is what hemophiliacs usually die from. Well, you can die from multiple bleeds in the joints, but and that AZT does that. You take AZT and you're going to have bleeding in the stomach.
So you think he actually died from the medicine they were giving him?
Absolutely.
Is what killed him.
Yeah.
But they would have never admitted that, would they have?
I called I think he was the head, or one of the doctors at the South Bend Medical Foundation and told him about it. I sent him articles. And he said, well, what it says on a death certificate doesn't necessarily mean anything. He was admitting, okay, so that was on a death certificate, internal bleeding. He said, that doesn't prove he didn't die from AIDS. You can't win with these people. Arthur Ashe wrote a book just before he died, and I think it was in the book. I read the book, but he may have relayed this to a friend who was quoted about his statement. He said, I know that Peter Duesberg and other scientists think that this thing is a big mistake, but he says, what will I tell my doctor who's administering these drugs to me? He said, I'm caught in the middle. So he stayed on the drugs and he died. Yeah.
And Magic Johnson got off the drugs.
Well, he was on TV 2 days ago.
Oh, yeah?
Yeah, he looks hardy and healthy.
Today is November 29th.
Yeah.
2004. And when did Johnson, when did that, that was like 10 years ago? 15?
Something like
Yeah.
that. I don't remember.
So he was on 2 days ago.
Yeah. Yeah, World AIDS Day is coming up, I think, in 2 or 3 days. So the propaganda machines are cranking it out right now. I think tonight or last night on one of the, it's not a broadcast network, CNBC or one of those
pushing it,
is having an hour program. Dr. Sanjay Gucha, or whatever his name is. Yeah, hour program. I saw some parts of it.
I mean,
some previews.
In other words, supporting the whole AIDS theory.
Oh yeah, yeah.
It's like believing in it. I believe evolution is wrong, and so it's like promoting the whole evolution theory when you personally believe it's not true.
Yeah.